we're right up there. Fantastic. Okay, I'm going to talk about post-operative GI tract dysfunction, or at least attempt to. Let's start with a bit of epidemiology. My name really is Monty Mythen, by the way. A little bit of epidemiology. I'm sorry the slides have become a bit compressed here from the transfer. Onset, duration, and severity. Well, onset, immediate, early or delayed, duration, transient or persistent, severity, minor, moderate or severe. And really the primary focus is the early 6 to 48 hours onset of what becomes persistent GI tract dysfunction that delays duration of hospital stay, that manifests itself as intolerance of enteral diet and, in some extreme circumstances, systemic manifestations such as multiple organ failure. Ileus was referred to a number of times in questions. I don't use the term ileus. I don't think it really helps. It's very poorly defined. It covers a spectrum of clinical signs, including abdominal distension, lack of bowel sounds, delayed passage of feces and or flatus. If you review the literature, which I have done relatively recently, there's thousands of articles, and the incidence ranges from 5 to 100%, even in the same type of operation. So I don't know what ileus is. I prefer to talk about post-operative GI tract dysfunction. I'm really sorry, I didn't realize that my slides have become bastardized in some way by the transfer of the information, but never mind, I'll press on. Post-operative nausea and vomiting is not the subject of my talk. That's reviewed ad nauseum elsewhere, sorry for the pun, so here's just one example, a fine example from T.J. Gann in 2003. I'm not talking about early PON-V, that's not what I'm talking about. I'm talking about post-operative GI tract dysfunction, of which the best definition that we can agree in the literature is intolerance of enteral diet. Now, we don't need to get smart here. We know not everyone's tolerant of an enteral diet to begin with, but if post-operatively you are intolerant of an enteral diet where you were tolerant of one preoperatively, then your gut doesn't work properly. And we all know that the gut is the second most important organ in the body.